The second AETCOM module for first year MBBS students is what does it mean to be a patient? So in this module, we will go through the approach required by a doctor to treat human sufferings. And the students will explore empathy and keep patients' experience in perspective during their learning. And the students will also understand the difference between healing and curing. Objectives of this teaching module are medical students shall be able to define empathy and enumerate its components, describe empathy in patient encounter, discuss importance of empathy in patient care, define medical ethics, discuss principles of medical ethics, describe role and responsibility of physician to their patient as per the code of medical ethics, describe responsibility of physician to each other as per the code of medical ethics. Then we will see what are unethical acts, what is euthanasia, and discuss its perspective in India. We will discuss the code of conduct for doctors in relationship with pharmaceutical and allied health group. And lastly, we will see what is professional misconduct and its punishment and disciplinary action. What is empathy? So when a patient gives history of his clinical condition, it is not just the signs and symptoms. He is actually narrating a story of how illness has affected his family, how it has worstly affected his social life, how it has led to distress in his career. So there is a sense of grief, regret, and many such difficult emotions are involved. Maintaining empathy is again very difficult on the part of physician, because on one hand we as physician know the actual clinical condition of the patient, and we need to explain the real health status to the patient, that is without detached cognition. On the other hand, we say that the physician can accurately view patient's emotion. So empathy involves more of emotional resonance. And we can define empathy as the act of correctly acknowledging the emotional state of another without experiencing that state oneself. So this word empathy is derived from a Greek word empathia. Empathia means in, and pathos means feeling. So, inner feeling. Clinical empathy is to understand patient's situation, perspective, and feelings, and to act on that understanding with the patient in helpful way. So, there are four components of empathy: emotive, moral, cognitive, and behavioral. Emotive empathy is the ability to subjectively experience and share in another's intrinsic feeling. So it is again dealing with emotional aspect. So some uh, physicians are more concerned about danger of getting too much involved with the patient's emotion, while for some physicians it is just a professional interaction. Then the second aspect is, or second component is, moral empathy. So it is internal altruistic force that motivates practice of empathy. So the moral stance is more of ethical values. Third component is cognitive empathy. So it is intellectual ability to understand another person's perspective from objective stance. So it entails physicians intellectual entering into patient's perspective, beliefs, and experience without feeling patient suffering at emotional level. Okay. Then the fourth component is behavioral. So here the communicative response to convey understanding of another's perspective is behavioral empathy. So it is more of action component. So the physician is able to act accurately on the basis of understanding, and it is done by checking back with the patient that you have understood correctly. So, by taking feedback from the patient, that is behavioral or communicative response. So, these are the four components of empathy. Why do we need empathy in our practice? Empathy is important because it builds patient's trust, it decreases anxiety of the patient, it improves health outcome, it increases the adherence of medication by the patient, it decreases malpractice and medical errors, and it increases patient's satisfaction, and expressing empathy advances humanism in health. Steps involved in showing empathy to a patient are: treat the patient and not just the disease. So, by expressing empathy, you will build trust with the patients, right? Then, give a nod or paraphrase. So, what you hear or demonstrate that you are hearing the patient and you are understanding them. Then, make eye contact. Eye contact is essential for connecting with the patient. Then comes improve your observation skills and be aware of your body language. If you take history by sitting down, it doesn't take extra time, but it shows that you are not in hurry, right? Then touch the patient socially. So move out of the boxes on just medical recording and know about the patient's life. Communicate and support patients by responding to their emotional and medical needs also. It is not just the medical recording, but we have to deal with their emotional needs also. Then keep in mind the demographic factors like race, religion, gender, socioeconomic status, cultural background, and avoid judgment or assumptions. Just recognize the patient's feeling. That is deep act of empathy. Medical ethics is a system of moral principles that apply values and judgment to the practice of medicine. And ethics is moral reasoning of actions. Morality refers to social norms that distinguish right from wrong in human conduct. So, ethics refers to professional moral conduct, and moral action is based on professional character and ethical principles in each and every profession. Why the necessity of medical ethics have increased so much nowadays, or what is the importance of medical ethics? So the high tech medical era has increased cure rate, right? But it also creates economic burden on the community, and it leads to litigations. So proper medical ethical guidelines will help in resolving litigations, and it will also help in making decisions on both the sides, means by the physician as well as by the patient. And ethical dilemmas of high tech medicines or equipments, brain death, organ transplantation, in these all conditions there is concern about quality of life, and it has become increasingly prominent in such conditions. Ethical guidelines will provide necessary solution. So in all these dilemmas, if we get a proper guideline, it will help us to resolve the problem. Also, day by day the conflicts are increasing among the physician and patients, and their consequences are more serious and more complex. So if ethical guidelines are there, they will help us to provide confidentiality, truthfulness, and there will be improved doctor patient relationship. It will help in maintaining dignity, justice, accountability of medical profession, and thus it will prevent unethical practices. There are four fundamental principles of medical ethics: autonomy, justice, beneficence, and non malfeasance. So autonomy means patient has freedom of thoughts, intention and action when making decisions regarding healthcare procedures. So whenever we are conducting any procedure or we are giving a treatment, then the patient will decide whether to continue the treatment or whether to accept the treatment or to discontinue it. Therefore, the decision making process must be free of coercion or coaxing. So there should not be any pressure or compulsion or force to take the treatment. So again, while taking informed consent, a physician should truly explain the treatment, alternative treatment plan, all the risk and benefits of the procedures, and likelihood of the success. The physician should also maintain privacy and confidentiality of a patient's intimate information. Thus, autonomy is the right to take decision without any force or compulsion. Then the second principle is justice. The healthcare providers must consider four main areas while evaluating justice. First is fair distribution of scarce resources, then competing the needs, rights and obligations, then the potential conflicts with established legislation. The next is beneficence. So the procedure should be provided with the intent of doing good for the patient, and the healthcare provider should maintain the skills and knowledge, continuously updating their through training procedures, and they should strive for the benefit of the patient. And it is patient's personal decision to determine what is good for him or her, and which may differ from the decision of the doctor and family members. And the fourth important aspect is non malfeasance. So here, uh, the meaning of non malfeasance is a procedure should not harm, or it should minimally harm to the patient to reach a beneficial outcome. When an intervention creates positive outcome, uh, while also there are some potential harm in it, it is known as double effect. So in such condition we have to see that the benefit is exceeding the harm, and for every regime risk benefit analysis should be done by the physician. In this slide we have enlisted regulations of Indian Medical Council for the Code of Medical Ethics. So we will go through all these 8 regulations one by one in detail. At the time of registration, a medical practitioner owes to live for service of humanity with conscience and dignity, impartial to religion, nationality, race, politics. Also, the practitioner promises to abide with the code of medical ethics. As per professional code of conduct, the responsibilities of physician in general are: a physician should be of good character. So, what does it mean? A physician shall hold dignity and honor of his profession. So, the prime duty of medical profession is to render service to humanity, irrespective of rewards or financial gain. So, this is all subordinate consideration. So, there is obligation of conduct in accordance with its ideals. A physician should be pure in character and should be diligent in caring for the sick patients. And a physician should be modest, sober, patient. He should have patience, should be prompt in performing duties without anxiety. And no person other than a doctor having qualification recognized by Medical Council of India and registered with Medical Council of India or state medical council is allowed to practice modern system of medicine or surgery. Then maintaining good medical practice. So what does it mean? The principal objective of a medical profession is to render service to humanity with full respect for the dignity of profession and that person. So, physicians should merit the confidence of patients entrusted to their care, and rendering each full measure of service and devotion. A physician should try continuously to update or to improve medical knowledge and skills, and should make this knowledge or this skill available to the patients and colleagues. So the benefit of their professional attainment should be there, and the physician should practice methods of healing founded on medical or a scientific basis, and should not associate professionally with anyone who violates the principles or the professional code of conduct. And the honored ideas of the medical profession implies that the responsibility of the physician extend not only to the individuals but also to the society or the community in which the physician is staying. Then again there should be membership in medical society. So for the advancement of his profession, for upgradation, we can say a physician should affiliate with associations and societies of allopathic medicine professions, and should involve in the functioning of such bodies. And a physician should participate in professional meetings as a part of continuing medical education programs for at least 30 hours. Every 5 years, at least 30 hours, the physician should participate in such programs organized by reputed professionals or academic bodies or any other authorized organization. So the compliance of these requirements shall be informed regularly to the Medical Council of India or the State Medical Council, as the case may be. Then maintenance of medical records. So what does it mean? Every physician shall maintain the medical records pertaining to their indoor patients for at least 3 years from the date of admission or commencement of the treatment, onset of a treatment, in a standard pro forma which is laid by Medical Council of India. Then, if any request is made for medical records either by the patient or authorized attendant or any legal authority involved, uh, the same may be the duty acknowledged, and documents shall be issued within the period of 72 hours. So, if there is any legal conflict, and if they ask for the documents or the records, they should be issued within 72 hours. And a registered medical practitioner should maintain a register of medical certificates giving full details of certificate issued. So when issuing a medical certificate, he or she shall always enter the identification marks of the patients, and should keep a copy of that certificate. And the physician should not omit the record to record the signature, especially signature or thumb mark and address. At least one identification mark of the patient should be there on the medical certificate or report, and it shall be prepared as per the guidelines given by Medical Council of India. And effort should be taken to computerize all these medical records for quick retrieval, we can say. Then display of registration number. So every physician shall display the registration number that is provided to the physician by State Medical Council or Medical Council of India in the clinic, and in all his prescriptions, certificates, receipts, And the physician shall display as suffix to their names only recognized medical degrees or such certificates or diplomas or memberships or honors which confer professional knowledge or recognize any exemplary qualification or achievement. Okay, so that is displaying registration number. Then the physician should always use generic name of drugs. So every physician should, means as far as possible, should prescribe generic drugs, and they should ensure that there is rational prescription and use of drugs. Then so the next duty of physician is highest quality assurance in patient care. So every physician should safeguard their profession against those person who are deficient in moral character or education. So a physician should not employ in connection or should not tie up their medical practice, their professional practice with attendants who attendant who is neither registered nor enlisted under medical acts in force. And the physician should not permit such person to attend or to treat or perform any operation upon patients wherever professional discretion or skills are required. Next duty is exposure of unethical conduct. Means a physician should expose without fear or without any favor. They should expose the incompetent or corrupt or dishonest uh, uh, or if there is unethical conduct on the part of member of their profession, that should be exposed without fear or without doing favor to them. Then the next responsibility is payment of professional services. So the physician engaged in medical practice shall give priority to the interest of patient. So the personal financial interest of a physician should not conflict the medical interest of patient, and a physician should announce his fees before providing services to the patient, and not after the operation or after the treatment, or if the treatment is in way, and remuneration is received for such services, and it should be in the form of amount specially announced to the patient at the time of services. And it is unethical to enter into a contract of no cure payment, right? So a physician rendering service on behalf of the state shall refrain from anticipating or accepting any consideration. Next is evasion of the legal restrictions. So, a physician shall observe the laws of our country, India, and regulate those laws in their practice of medicine, and shall also assist others to evade such laws. And he should be cooperative, and enforcement of sanitary laws and regulations in interest of public health. Then a physician should observe the provision of state acts like drugs and cosmetics act. Then pharmacy act is there, narcotic drugs, then psychotropic substances, then medical termination of pregnancy, organ transplantation, and mental health act is there. Then there are other legal restrictions like there is environmental protection act, prenatal sex determination test is there. Then we have drugs like quack remedies, some provide drugs and magic remedies. So these are objectionable advertises. Then persons with disabilities, then There is biomedical waste, management of biomedical waste. Again, there are some rules for them, rules and regulations, and there are many more such acts. So your regulations are made by central and state government, or even local administrative bodies are there, and such acts relating to the protection and promotion of public health are there, and the physician should follow all these laws and regulations related to legal restrictions. Duties of physician to the patient. So first duty is obligation to the sick. So though a physician is not bound to treat all patients or each and every person who is asking for services, but he should be ever ready to respond to the calls of the sick and injured person. And the physician should be mindful of high character of the mission and responsibility uh, in the course of professional duties. So, in his treatment, he should never forget that the health and lives of the person who has trust on you, means who is entrusting you to his care, depends on the knowledge, skill, behavior, and attention of the physician. So, a physician should make the patient or the sick person comfortable by making visits at are indicated to the patient. Then the physician advising a patient to seek service to another physician is acceptable, but in case of emergency a physician must treat the patient. No physician shall arbitrarily refuse treatment to a patient. And but however, for good reasons, when a patient is suffering from ailments which is not within the range of the experience of that physician, treating physician, then the physician may refuse treatment and can refer the patient to higher center or some other physician. And again, the medical practitioner having any incapacity detrimental to the patient's health or life, or which can affect the performance of the patient, is not permitted to practice his profession. Then the next duty is patience, delicacy, and secrecy. Means patience and delicacy should characterize the physician. Confidence concerning individual or domestic life entrusted by patients to a physician, and defects in the disposition or character of a patient. Um so these are observed during medical attendance and should never be revealed unless their revelation is required by the law of state. Sometimes the physician must determine whether his duty to the society requires him to employ the knowledge obtained through confidence um, as a physician, or to protect a healthy person against a communicable disease to which he is about to be exposed. So, in such instances, the physician should act as he would wish another to act towards one of his own family members in such circumstances. So, the physician should have patience and should maintain secrecy or confidentiality. Then, next duty is prognosis. The physician should neither exaggerate nor minimize the condition or the gravity of patient's condition. He should ensure himself that the patient or his relatives or his responsible friends have such knowledge of patient's condition, as well as they should serve the best interest of patient and the family. Then the next duty is patient must not be neglected. Okay, so a physician is free to choose whom he will serve. He should, however, respond to any request of his assistants in case of emergencies. And once having undertaken a case, a physician should not neglect the patient, nor should withdraw the case without giving adequate notice to the patient and his family. And provisionally or fully registered medical practitioner shall not willfully commit an act of negligence that may deprive his patient or patients from necessary medical care. That is act of negligence. Then engagement for an obstetric case. So when a physician who has been engaged to attend obstetric case is absent and another is sent for delivery accomplishment, then the acting physician is entitled to his professional fees, but should secure the patient's consent to resign on the arrival of physicians engaged. So that is engagement for obstetrician's case. We will see the duties of physician in consultation now. So unnecessary consultation should be avoided. However, in case of severe illness and if there is any difficult condition, the physician can request other physician to consult. But under any circumstances, such consultation should be justifiable and it should be in interest of patient. Only then it is allowed, and it should not be for any other consideration. Then consulting pathologist, radiologist, or asking for any other diagnostic lab investigation should be done judiciously and only if it is required and not in a routine manner. Then second is consultation for patient's benefit. So in every consultation the benefit of patient in is most important, we can say it is for most important, and all physicians engaged in the case should be frank with the patient and his attendants. Third is punctuality in consultation. So, utmost punctuality should be observed by a physician in making themselves available for the consultation, and they should be present at the time they have given appointment to the patient or their relatives. Then, statement to patient after consultation. This means all the statements to the patient or his representatives, family members, they should take place in the presence of consultating physicians, except as otherwise agreed, and the disclosure of opinion to the patient or his relatives or close friends shall rest with the medical attendants. And if there is differences of opinion, it should not be divulged unnecessarily. But when there is means need and there is difference of opinion, the circumstance, in such circumstances we can frankly and impartially explain to the patient or the relatives or the friends, and it would be open to them to seek further advice as they desire. And the next duty is treatment after consultation. So no decision should restrain from attending physician from making subsequent variation in the treatment. If any unexpected change occurs, but at the next consultation, reason for variation should be explained to the patient. It should be discussed with the patient. And the same privilege with its obligation belongs to the consultation or consultant himself when sent for in an emergency during absence of attending physician, and the attending physician may prescribe medicine at any time for the patient, whereas the consultant may prescribe only in case of emergency or as an expert when he is called by some other doctor for expert opinion. Then next is the patients referred to specialist. So when a patient is referred to a specialist by attending physician, a case summary of a patient should be given to the specialist, who should communicate his opinion in writing to the attending physician. Then fees and other charges. So a physician shall clearly display his fees and other charges on the board of his chamber or cabin or hospital he is visiting, and the prescription should also be made clear if the physician himself dispensed any medicine. Then, and a physician shall write his name, his designation in full form along with the registration number provided by Medical Council of India, and particulars in his prescription letters should be there. And in government hospitals where the patient load is high or it is very heavy, then the name of prescribing doctor must be written below his signature. Physician is abide to responsibilities towards his professional colleagues. So first is dependence on physician on each other. So if there is anyone sick in the family of one physician, then the other physician should render services to that physician and their family members. That is dependence of physician on each other. Then conduct in consultation means if a physician in charge calls for consultation to some other physician, then the consulting physician should give respect to the treating physician and should not make any loose talk or should not pass any statement or remark. Then third is consultant not to take charge of the case. Again, when a physician has called for consultation, the consultant should not take the charge of the case. Uh, he should only treat the patient when the treating physician will ask for expert opinion. And the next is appointment of substitute. A physician should accept the request of another physician to attend his patient during his temporary absence when he has the capacity to discharge additional responsibilities along with his routine duty. Then the visiting another physician's case. So when we are visiting some other case of a physician, we should avoid making remark on the diagnosis or treatment part given by physician in charge. Physician to public and paramedicals are the when we see the physician as citizen, they should cooperate with the authorities in administration of sanitary and public health laws and regulations. Then the physician should enlighten public concerning quarantine regulations and measures to prevent epidemics and other communicable diseases. Then they should recognize and promote practice of different paramedical services, and they should seek cooperation whenever it is required by the pharmacist or nurses. So here we will see a list of act which is considered as unethical by the professional code of conduct. So first is advertisement. So only there are certain conditions where advertising is permitted. So if a medical practitioner is starting new practice, or there is change of the type of practice, or if there is change in the address of the physician, or if the physician is temporarily absent from his duty, or has resumed to some other practice, or succeeded to another practice, or if want to do some public declaration of charges, in such conditions formal announcement is permitted. Then the next is patent and copyrights. So it shall be unethical if the benefit of such are not made available in situation where the interest of large population is involved. Third act is running an open shop. Dispensing of drugs and appliances by the physician is considered unethical. Rebates and commission means a physician shall not give or receive any gift or monetary gains, or any kind of commission or bonus in consideration of, or return for the referring, recommending, or for consultation, or for procuring of any patient for medical, surgical, or other treatment. Then secret remedies means the prescribing or dispensing by a physician of secret remedial agent is again unethical. Then violation of human rights is again unethical. Now euthanasia is very important, and we will see it in detail. So the code of conduct for doctor is in their relationship with the pharmaceutical and allied health sector industry. So what is euthanasia? We say that it is unethical act. So euthanasia is defined as administration of some fatal or lethal agent by another person to a patient for relieving some intolerable or incurable suffering of the patient. That is euthanasia. The euthanasia can be active or passive. Active means purposely giving someone a lethal dose of sedative, and is so such in such condition it is considered active. And passive euthanasia is withholding or limiting life sustaining treatment so that a person passes more quickly. So there is for example increasingly high dose of some painkiller medications. Over time they become lethal, they become toxic. So that is passive euthanasia. So there is difference between passive euthanasia and palliative care. Okay, palliative care focuses on keeping people comfortable as comfortable as possible at the end of their life. And a palliative care doctor might allow someone approaching death to stop taking medication that causes unpleasant side effects. So, in other words, they might allow someone to take much higher dose of painkiller or pain medications to treat severe pain. So, this is often a standard part of good palliative care, and many physicians don't consider it as euthanasia, passive euthanasia. Again, the euthanasia can be voluntary or involuntary. So if someone makes conscious decision to seek help with ending their own lives, it is considered voluntary euthanasia. So the patient or the person must give their full consent, and should demonstrate that they fully understand what will be the consequence of this, what will happen. That is voluntary euthanasia. And involuntary involves someone else making the decision to end up someone's life. So a close family member usually makes such decision, and this is generally done when someone is completely unconscious, or is permanently incapacitated. So it usually involves passive euthanasia, such as withdrawal of life supports from someone who's showing no signs of brain activity. So it is also known as mercy killing. The act which is considered as misconduct by the medical code of ethics are violation of regulations, improper conduct, conviction in the court of law, sex determination, signing false professional certificate reports and documents. So, any registered practitioners who is shown to have signed or given under his name and authority any certificate or notification or document which is not true or which is misleading or improper, that physician is liable to have his name deleted from the registration as a medical practitioner. So the last regulation of Indian Medical Council for the Code of Medical Ethics is punishment and disciplinary action. So if there is any litigation by a patient on the physician, then first the complaint is heard by the appropriate authority like state medical council, and if appropriate medical council decision is not acceptable, then the petitioner or the registered medical practitioner may appeal to the Medical Council of India, and that too within 60 days from the date of order. And once found guilty, then the physician is punished by the Medical Council of India as means initially warning is given, then some official action is taken, and ultimately there is termination or cancellation of registration, which can be temporary for a specific period of time or it can be permanent.